Hi, everyone. Welcome to One Health Wednesdays, where we have conversations and clarity at the intersections of people, animals, and planet. I'm Dr. Ginger Dixon. I'm a public health strategist, a systems consultant, and believer in infrastructure that supports the One Health mission and not scrambles it. On Wednesdays, we dig beneath the surface of One Health to work on what's really shaping your efforts. Today, we're going to be talking about frameworks and gender equity in One Health. And we have something a little different for y'all today that I'm super excited about. We have a group interview from the Network for Ecohealth and One Health. And I am going to pass it on to Dr. Julia Zammit to introduce herself and the group.
Hi, I'm Dr. Julia Zammit, also a guest host on One Health Wednesdays. You might have heard me on the podcast a little bit before. I'm a veterinarian and a One Health specialist, uh, kind of an enthusiast in social sciences. And this is why we are kind of here talking about gender. Yes, and I'm glad to be here to talk to the group. It all started with Evan's podcast. So maybe we can start introducing the group, maybe with Evan, since we already know him, and we'll carry on from there. Thank you.
Yeah, thanks so much. So, my name is Evan Griffith. I'm a veterinarian and also a PhD candidate at Tufts University. And I've been part of this working group for over a year now and have absolutely loved the experience. So, I'll just tag someone next based on my videos that I can see here. So, Elena, maybe you can introduce yourself next.
It's Elena here. I'm also part of the NEO group since quite a long time. I'm so happy to be part of the group. I come from actually being a chemist and then specialized in the endocrine disruptors. And the importance of gender expert is fundamental. So that's why I embrace so much the NEO and the gender equality perspective. And I'm so happy today to be here to discuss also my point of view and the togetherness that we join with the group to be different expertises working for the same goal. And
Amazing.
Julia?
Hi, my name is Dr. Julie Garnier. I'm a veterinarian and a One Health expert and practitioner. I'm also a passionate advocate for equity, resilience, biodiversity, and nature. For 25 years, I've been working closely with communities in some of the world's most threatened ecosystems, from African savannas to the steppes of Mongolia, coral reef, and coastal forest, and co-designing and implementing One Health programs that put nature, women, and equity at the center. Through an organization I co-founded, Odyssey Conservation Trust. And in 2018, following on the work of the Network for Evaluation of One Health, which has now become NEO, we co-founded the Gender Working Group of NEO with a few colleagues that are here today and we'll be explaining with great detail some of the work which has been amazing that we've put together.
Maybe Sara can carry on.
Yes, sure. Thank you. I'm Sara. I have been with NEO from the very beginning, and I will tell you later what was the beginning. And so it's over 10 years now. And then I also became member of the gender group. So here we are all together to tell you what we do. Maybe Brigitte can go on.
Okay, thank you. So my name is Brigitte Bagnol. I am an anthropologist, been working for more than 40 years already on gender issue, including gender in different perspective, in different situation, in different organization, and working mainly on One Health issue. It's why I'm part of this group. Thank you. Over to
Carla, last but
Sara.
not least.
Sure. I'm Carla Berger. I'm a veterinarian specialized in international development and workforce development and One Health. I am a former consultant for the World Health Organization based in Geneva, And at the time that I was working at WHO, I was responsible for developing the implementation guide for the One Health Joint Plan of Action. That was about 2 years ago. And because of my involvement with the implementation guide, I have been invited to join this NEO group to contribute to the guidelines. And so that's what brought me to the group. I'm also a member of Women for One Health. Thank you for having me.
Amazing. So maybe one of you can discuss the actual, what is the network? So the network for Ecohealth and One Health, NEO. Can someone explain to me a little bit, or to everyone, what it's all about?
Yes, thank you for that question. We like to brag about it. Well, Network for Ecohealth and One Health, as we're called today, at the beginning was Network for Evaluation of One Health, and we became from a cost action that was done somewhere in 2014. And after the cost action has expired, cost action is a European project. And after that project, we did not want to part. We wanted to stay together and continue working. So we decided to form some kind of association that will allow us to stay together and work under the same name. So we renamed Network for Evaluation of One Health to Network for Ecohealth and One Health. So the letters are the same, but we just changed the words. And we found that there is a Ecohealth international organization which lacks European chapter. So we became the European chapter of Ecohealth International. And so far we have been working like that. We have a few working packages working groups, within our NEO. And one of them is gender group that you will hear a bit about later. We have a few achievements that we like to brag about. So the first one was still under the old NEO. That was the handbook about the evaluation of One Health, where we explained how you can evaluate either a project or some kind of One Health initiative, how you can evaluate how much One Healthness it has in itself. That was quite a success. But then sometime after COVID, like 4 years ago, we decided that we want to write a textbook on One Health. And that took a while, and that was quite a ride for a few years. But in December or this January, it came out. Now it's online, free to download. And we're very, very proud about it. There are over 70 people involved, 70 authors involved in the textbook. And so we think that it's really an international achievement. Beside these two books, we also have some papers. One of the papers was about competencies. It was the first author was Gabrielle Lang, who is also chairing at the moment our network. I'm co-chairing, and Evan is secretary. So we somehow represent NEO at the moment. And that paper was about competencies. And the whole book is actually going around the competencies that you need to have when you're dealing with One Health. And we like to emphasize that those competencies are actually the core of education on One Health. I will not take any more time. I think this was a nice introduction for the next question.
And regarding gender and the working groups, what else have you been involved in? So it's amazing, the book. I've read into it quite a lot. The core competencies are exactly, I think, what maybe, for lack of criticism, what we all should have been taught I agree, when you learn about One Health rather than certain areas of One Health. But what do you think about the gender aspect of the working group? What do you think you've actually done apart from the book? Maybe Sarah or Elena, someone can carry on.
I think it's, yeah, well, we've created the gender working group when the second NEO program network was initiated. I think we all felt at the end of the previous network that there was the gender issue was clearly lacking. It was not addressed. And we created the working group. And to start with, it was a small group of us. Well, it was still a small group, but it's grown from 5 people to 10 people. And we've got obviously some people coming in from time to time. But we are now a strong nucleus of various people from different disciplines and backgrounds. Some are more anchored with field experience, and others, are academics or consultants. And I think that brings a lot of strength to our network. We are all sort of passionate, really, and committed, obviously, to advancing gender equity through One Health. I think there was a strong feeling that it needed to, a bit like when you see, these climate conferences or other conferences, and you see a major representation of men on the pictures. We felt, there was a time then our presence was needed, like in all disciplines and all decision-making structures. Obviously, we need representation, we need fairness and equity. So our commitment is really advancing gender equity through One Health and using gender-responsive One Health as a tool for transformative change. I think we all know, that the challenges we face today, from climate change, biodiversity loss, pollution, health inequities, are all interconnected. That's why we need a One Health approach to tackle them. But what's often overlooked is the fact that gender inequality is the cross-cutting issue throughout all of them, and is one of the deep drivers of all these crises. So unless you address these issues in a very profound way, unless you address gender equity, you are not going to solve this crisis. What we also know is that, women, girls, and marginalized groups are also those who suffer the most vulnerable, usually from environmental degradation, from climate-related disasters, disease outbreaks, and exclusion from health services or education or decision-making. And yet we know that they are incredible agents of transformative change. So building on this reflection and experiences, this is something I've personally experienced, throughout all the field work I'm doing, putting women as agents of change can bring the most incredible results. And I think I know Brigitte will share the same experience. Evan probably as well. It's just amazing, how you can bring change in communities, and improve health, and improve well-being, and improve economic outcome by empowering women. So building on that, we developed our first sort of major paper, which was helping to heal nature and ourselves through human rights-based and gender-responsive One Health. That was before the pandemic. We published that in One Health Outlook in 2020, and we reviewed gender roles, how this shaped risks and responsibilities at the human-animal environmental interface, how, indigenous people and local community also are critical actors and important knowledge holders in One Health. And we demonstrated how, we needed to address these underlying drivers of inequity to address the current crisis. And then the pandemic, the COVID pandemic hit. And that was amazing because we had just published the paper, and suddenly all what we had been saying came out blatantly in all the newspapers. Just for example, when you had people clapping because they could see health workers, going out to work in hospitals, and all of 75% were women, and we knew they were so important, and suddenly the world realized how important women were and how important gender issues were. So then we published another position paper, which was gender responsive One Health. Now is the time. We keep reiterating that. During the pandemic crisis, it was like, if we want to do it, let's do it now. No time to lose. And then we have published another 2 major contributions, which Sara and Elena will mention, our chapter in the handbook, which is an absolutely amazing publication. Another one, Gary Go, the guidelines for National One Health Action Plan, that will be also explained about. But I think our group, is amazing because we all busy. We all have roles, responsibilities as women. We all sort of juggle between family responsibilities, between our work, and we do it. But we don't only publish papers. Publications alone don't bring change. We raise awareness on One Health and gender. We build capacity on One Health and gender. We developed One Health solutions on One Health and gender. And while we continue having our own activities where we mainstream gender, obviously, into One Health. So equity, it's not just the right thing to do, but it's going to make One Health a lot more effective and impactful and powerful. So that's why we're working together, and we invite you all to join us if you want to bring change. Thank you.
Thank you. Wow. I have to try to gather my thoughts. It's quite a powerful, you really explained it well. Thank you. So the textbook that seems to going to be changing our world, and at least in the One Health sphere, if not in other areas. Can Elena maybe explain a little bit this really important chapter that envelops gender within this really great book?
Yes, thank you so much, Julia, also because she got the point. And just the book is like an excuse, let's say, to go also to the school, universities, and have something very educative method with the educational method to explain everyone, the students, but also the teachers, and having a methodology, let's say, to go through what means gender equality in the context of One Health. I have here the overview of the contents about the book, and is from the very beginning we wanted to explain what is gender equality in the context of One Health. And with simple question, but also reasoning, and also like imaging with the figure and understanding of relationship. For example, relationship of the gender, relationship of power, and acquired relations and given relations. So something that is what is the meaningful for us. I mean, to give the lens, I always say, as other of my colleagues, the lens of gender in everything we do. And going through the book, you can see how do sex and gender interact, because always there will be someone not really understanding the difference, and it's good to go through and explain very well. What I like the most also is the examples we took in the book, because the example is something from the one that collaborate in this group are all from different expertise. So we've been working with the example. Myself, I took the example, as I mentioned before, of endocrine disruptors, how they affect differently the gender, and then how they relate different in One Health and the gender. And veterinarian, they took brucellosis, for example. Then we have also the climate change that is so nowadays, and is part of one of our examples. And then we make students or teachers or everyone think about with some questions. So there is some question in the chapter, but all the book is made like that. But with some question where everyone can have an understanding if the concept can arrive or not to the understanding of the reality of their own life. because what we want to give people is this methodology, but also use of gender equality lens in One Health. So it's a step further, the knowledge, and then the understanding, and then the application. Then there are all the reference, and the good news is that now everyone can download the chapter, is online. We will put all the links here. So we are very happy also to receive questions or to just interact with everyone is curious about. And yes, I don't know if there are any question about the book more or the chapter, or I can pass the word to someone else.
Thank you. Yeah, it's quite in depth as well, because I think gender kind of obviously is a cross-cutting subject, as Julie was saying. And when just looking at the topics or the little chapter overview, I think it really encapsulates how gender is this cross-cutting problem, I think, or it can be also something that we could empower and we can actually use. So I think this is amazing, and I hope our listeners will read the chapter and also the book if possible. So thank you for that little overview. I'll pass it on to Ginger. Thank you.
Yeah, absolutely. And thank you all. As Julia said, you all said it beautifully. And I'm excited, that y'all are combining both the theory and the use. I was going to ask about like the importance of mainstreaming gender and One Health. I think that y'all have really explained it beautifully. And I think what I'm curious about is how with on the use side of mainstreaming gender, in One Health specifically, I'm curious about what types of outcomes you expect from this work, from involving gender equity in One Health. And I would love to hear from Brigitte if you're available and open to it.
Thank you. I think it's amazing to understand how important is the integration of gender. We are not integrating only gender, actually. We're speaking about gender equity and social inclusion. We're speaking about GITSI into One Health approach. And the impact are multiples, because the impact are about outcomes, they are about sustainability, they are about equity, they are about human rights, they are about efficiency. So I will try to unpack a little bit. Maybe first, improve health outcome across different sectors. We're speaking about human, animal, and environmental sectors. When we integrate this GETC perspective, it allows us to understand better the risk, the exposure, the behavior, because we are analyzing the role of different group of people. We are analyzing their access to resources. So we are introducing a social inclusion lens to understand the different vulnerability amongst marginalized group, like indigenous community, person with disability. And I can give you an example. By example, we saw it during COVID-19, but we also saw it during Ebola outbreaks, when ignoring the role of women in Ebola related to caregiving and burial practices delayed the control strategy. During COVID, we didn't, a lot of people didn't understood that confining women would increase violence against women. So when we include all those perspectives, this GSV perspective, we allow for a more accurate understanding of the risk. So the intervention are more responsive to the reality. So this is for the health outcome, but there is also an impact on greater gender equity and gender justice in health system, because doing the a JETSI approach, we address the power imbalance in society, in access to resource, to health services, to participation in decision making. So by addressing those issues, we allow different voices to be heard. We allow people to adhere to the different strategy or suggestions that the health sector is proposing. So we ensure in a certain way that health for all includes all the people who are often left behind. So JETSI makes One Health more technically effective, but also more morally and more socially just. And that's why I was speaking about from a human rights perspective. It's also very impactful. So we said improved health outcome, improved equity and justice, and also more effective in terms of risk communication and community engagement. Because as we know better the risk the different groups are exposed to, we understand better the exposure, the behavior, we understand better their knowledge about the different situation, we can have a more informed approach to community. So it enhances the community trust, because we are going to include women, we are going to include the youth, we are going to include marginalized group. So people recognize that what we are doing are more relevant to them. So it improves acceptability and the cultural adequacy and relevance of the intervention. In addition to that, the system, the surveillance system is stronger when we include JETSI, because it means that we are disaggregating data. So we are not having data about who is sick and who believes this and that, or who does that. We are analyzing, looking at gender difference, we look at age difference, we look at different criteria, and this allows us to have a more a better understanding to the hidden vulnerability of different groups, and all, of course, of the different transmission patterns, of the different behavior of the different groups. So it also helps us to identify all those often misunderstood impact of zoonoses, of environmental degradation. So we can say that JETSI integration enhances the evidence for a One Health decision. And maybe the last point I would like to share with you is that it's integrating JETSI enhances resilience and adaptive capacity. It improves intersectoral collaboration, and in a certain sense, better economic efficiency and governance, because marginalized population are included. They recognize that we are supporting them. They are integrated in the decision making. So it enhances the resilience, and it enhances the governance. Also, it enhances collaborative governance amongst different groups of people, and a better economic efficiency, because ignoring JETSI leads often to costly expenditure that at the end of the day we can see and we can analyze that they are not effective. So JETSI prevent to waste resources and increase efficiency and programmatic impact of our intervention. It's why we are advocating for the integration of gender equality and social inclusion. I hope that I managed to give you some example and to give you a clear explanation of why it is so important to include JETSI approach in One Health. Thank you.
Thank you. That was a beautiful explanation. Absolutely. And I think you really hit on some very important, outcomes. Again, not just the health education and effectiveness of interventions. And as you mentioned, there's so much great research out there that shows time and time again when we involve marginalized groups, when we involve, women in health education, how much more effective those prevention and intervention efforts are. And so I think you did a great job of explaining those. And then also from a equity justice and a health justice perspective, how important it is to integrate this gender equity lens, especially in One Health, as we touch on so many different disciplines, that we're trying to bring together and de-silo. So thank you. That was wonderful. And I'm going to pass it on to Julia so that we can hear more about how you all are putting this into action.
Yeah, I think Brigitte has really built me up for my next question. Is you are putting together implementation guidelines, which you have called the Gender Responsive and Inclusive Implementation Guide for National One Health Action Plans, which is a real mouthful, but well done to you guys. So can someone give me a little bit of an overview of the One Health action plan and how we can move forward from this?
I think that's me. I'm up. So I'm happy to give you an insight into how the gender guideline is a piece that fits into a much bigger puzzle. So I'm going to start at the high level, which is the One Health Joint Plan of Action. And this is really an action plan that was developed by the quadripartite organizations. So that's the Food and Agriculture Organization of the United Nations, that's the United Nations Environment Program, the World Organization for Animal Health, and the World Health Organization. So these four organizations represent all the components of One Health. And they took on the initiative to develop this action plan in response to calls from countries internationally, globally, to have better tools to respond to pandemics. So the OHJPA, the One Health Joint Plan of Action, is really a result of the aftermath of the COVID pandemic, where countries said, come on, we need better tools to prevent pandemics and as well as respond to them. So the quadripartite prepared this action plan that has a duration of 2022 to 2026, and it was published at the end of 2022, and it really highlighted 6 action tracks for how countries can implement One Health, and these are priority action tracks that there's so many more actions that countries can take to implement One Health, including gender equity and inclusion, but it didn't make it into the action tracks. So we talk about strengthening health systems, reducing the risk of the emergence and reemergence of zoonotic diseases, controlling and eliminating zoonotic, neglected, and vector-borne diseases, strengthening the assessment, management, and communication of food safety risks, curbing the antimicrobial resistance silent pandemic, and the last action track is integrating the environment into One Health. So this action plan with all these action tracks was very well received by countries, but then they said, hey, that's all well and good, but how are we actually going to implement this in practice? And so that gave forth, that really inspired the development of the implementation guide to the One Health Joint Plan of Action, to provide countries with more practical guidance. And that's where I stepped in. That's where I was brought on board by the WHO Secretariat of the Quadripartite to develop this implementation guide. And in the implementation guide itself, that's the next level down from our pyramid, we steered a little bit away from action tracks because we realized that they were actually encouraging silos. Like if you think about an AMR silo or a food safety silo and a zoonotic disease silo, the way that we have been working, we wanted to move away from these silos. And so we thought, okay, how are we going to take a systematic, holistic approach, systems thinking approach, and that's where we brought in the pathways. So we have 3 pathways to the theory of change, and these pathways are really meant to provide the practical guidance for how countries implement One Health. The pathways are very simple. The first pathway is governance, that you have the right policies, legislation, and a governing body in place. So that governing body, on a practical sense, we're talking about a One Health platform or mechanism, and that can take the form of a committee. And that's often how it takes the form on a practical level, that if you want to implement One Health, you need a One Health committee that has representation from all the relevant sectors, that you have human health represented, that you have animal health represented, and environment health. Then pathway 2 is organizational and institutional development. That's capacity development or workforce development. We've got to assess the gaps in our workforces and then help strengthen our competencies in a cross-cutting way across sectors, not in our silos, that we can actually do joint trainings. Again, on a practical sense, what does that look like? It means we can do a training together between human health, animal health, and environment professionals. And then the last pathway is data, evidence, and information systems. This is talking about science and building the evidence base. We always need to be finding the evidence to support One Health activities. And so that's about research and to help support and justify our interventions and activities. So we did all this, this development of these super high level documents from 2022 to 2023. And then NEO, and not just NEO, but other committees recognize that there's still some gaps in our beautiful implementation plan. And one of those major gaps is that gender equity and inclusion is really not heavily featured or sufficiently featured in the implementation guide. And so very proudly and it's very inspirational that the NEO group has taken the initiative to fill the gaps in the implementation guide by preparing the implementation guidance for gender equity and inclusion. So now we're at level 3. That brings us to our focus here for today's podcast. So that's my piece. I'm happy to take questions, and otherwise I will move it over to Evan to talk more about the guidelines.
I think you explained that really well and thoroughly. At least people can start to understand how these guidelines and anything in One Health, how it's structured all together. So that was explained really well. Thank you very much.
Yeah,
Evan,
thanks.
Will you continue from here, please?
Yeah, thanks a lot, Carla, for giving that kind of perfect overview of what brought us to this point. And so just to sort of go off of exactly what you said, we have this really great implementation guide for the One Health Joint Plan of Action. And some of those steps in that guide talk about including gender, but they don't actually give specific guidance on how to do that. And so from the NEO perspective and us working together in this group, we thought, wouldn't it be great if there was a sort of additional guidance out there for when you're developing this National One Health Action Plan, how you actually incorporate these gender aspects and social inclusion. And it turns out there wasn't, and so we decided we should do something about that, basically. And so I just want to briefly go over the guidelines. I'm obviously not going to sit here and read every single question that we have in these guidelines. I just want to kind of give you a structural overview, and then maybe give you a couple examples of what specific questions may be for these different steps. But there's two things that I sort of want to emphasize first. One is that we did not want to come up with sort of a prescriptive, be prescriptive about actions. So the guidelines are really to prompt sort of consideration and reflection. And I think for a lot of us working in this space is that the first step is getting people to just think about these things. And so if, even if you can just have someone ask the question, that actually becomes really powerful for reflection and then driving action. So we didn't want there to be a really big barrier to using these guidelines. And also we know that countries and One Health practitioners are sort of at different stages of developing these. And so again, these are sort of general questions that promote reflection and action. And the other thing that I just wanted to mention too is that there was a really nice review that just came out, including one of our members, Dominique Chiron, who unfortunately couldn't be here today. And they were looking at One Health tools. And one of the big gaps in that review was actually that there aren't a lot of gender specific One Health tools out there. So we were also sort of trying to fill that gap. But basically, the guidelines consist of 32 different questions. And there's specific questions for each step of that One Health implementation guide. So what I'm going to do is just briefly tell you the name of the step and then give you one or two of these questions. Again, just to sort of provide a brief overview of what we did. So for example, the first step of the implementation guide is a situational analysis. And so an example of one of our guiding questions would be, is intersectional gender analysis conducted as part of the situational analysis? So very simple, right? But just was gender part of your situational analysis? And then of course, if it wasn't, then you have to go back and do something about that. So the second step of the implementation guide is to set up a multi-sectoral One Health coordination platform. And Carla sort of mentioned that. Of course, we're all familiar with One Health committees at the national level and the zoonotic disease unit, et cetera, et cetera. And so again, just as an example of a question, do governance and coordination mechanisms include underrepresented genders and socially marginalized groups? So are these groups that we're focused on actually part of your coordination structure, whether it's a committee or whatever it is? The next step is actually planning for implementation. So you have your One Health action plan, and then you want to actually start implementing your activities. And so an example question under this step would be, have you defined GESI specific objectives for each action track and pathway? So are you actually, and I think, during this conversation, we've talked about gender disaggregated data a couple different times. So is that actually part of the sort of outcomes you're looking at and the data you're collecting? And then the fourth step is the actual implementation of these plans. And so an example question would be, if inequity is discovered during One Health implementation, is there a mechanism in place to report and or address the inequity? And so again, these are thinking about these structural questions. If there's nothing in place to report when this is happening during your implementation, how can you correct it, right? And then finally, the last step is to review, share, and incorporate lessons learned. And so again, a simple question, do MEL systems report on progress towards the gender equity and social inclusion as part of the One Health implementation? So basically, does your monitoring actually include these considerations? So again, that is by no means a comprehensive list of all the questions. Hopefully this will be published soon and everyone can go out there and read and use this guide. But just to give you sort of a brief overview a brief overview of what the guideline is and sort of a taste of a few of the questions to hopefully get you interested in finding out more.
Great. Thanks, Evan. That was great that you could actually explain the guidelines to us a little bit as well. I don't know if you want to go a little bit into detail into how to incorporate this. Like, you kind of touched on it already, but maybe a little bit more detail into incorporating these operations into like a team or an organization, maybe from your experience yourself.
Yeah, well, I think I can touch on that in sort of two ways. One is sort of how we visualize or hypothesize how people are going to use these, and then some of the actual next steps for us is sort of a working group and future research. So the idea is that wherever you are in the stage of developing your National One Health Action Plan, and if you look out there, I know of at least two or three countries, and I'm sure there's many more who are sort of actively involved in this. And so this is sort of a side by side set of questions, guidelines for you as you're going through each one of those steps that I was talking about. You can actually ask yourself these questions. And what we've done in this paper is we've actually given a few examples of resources that you can use if you're not able to, if you haven't done what the guidelines are saying, right? So if you did not include gender equity and social inclusion considerations in your SWOT analysis, we provide some resources, not just for SWOT analysis, but for other things where you can actually go and take a look and see, what does WHO say about how to do this, or what does FAO say? Again, those are not all the resources that are out there, right? But we wanted to provide a few that would make that process easier. And then the thing that we really want to do is actually to pilot these guidelines. And so just like everything, when you develop something new, you want to pilot and refine the questions and make sure that they make sense. Are they actually helpful? Are we actually providing the benefit that we're trying to provide? And so we're currently looking for opportunities to actually get out there and work with a national, team to actually pilot these guidelines as that development process is taking place. And I think that's a really exciting opportunity because for us, the whole point of these is that they're very practical. Like I said earlier, we don't want a huge barrier to use. We want it to be a really helpful resource that just gets people thinking and reflecting on what they can do in terms of incorporating these concepts into their plans, into their monitoring, and that kind of thing. And so we're looking forward to the pilot. I can maybe take a step back if anyone else wants to jump in about the implementation or the impact of these guidelines or how they're going to be implemented. I can let someone else, if they would like to, jump in as well.
Maybe Sara wants to say something, or Brigitte. Sorry, I interrupted.
I think it's enough. I think you explain it nicely. You know what I mean? That's the objective.
I'll just add, sorry, I might just add that, it's a great, we try to keep the guidelines quite broad. So actually they're not only applicable to the national action plans, but they can be used for research programs, initiatives. I mean, they can really be used by many people working in the One Health field. So and obviously, they can be, we haven't gone into all the details so that we could just give broad recommendations. And if people can just implement this recommendation, that would be a huge step forward. That's why we've kept it simple. Otherwise, you can have indexes, for example. There's been various gender indexes which have been developed for various domains such as agriculture or health, etc. And they have become so complicated to implement that people will try to measure them to start with, and then after a while, it will not be implemented anymore. So I think it is something that we really want to be adopted, implemented, because it's easy to use. That's why it's not an index, it's a guide. And we'd love for people to try it, implement it, and give us feedback, so then we can refine it and adjust it as needed. Thank you.
It's amazing. So you don't have to be a gender specialist to use this. That's the whole point, I guess. That you can just, yeah, amazing. I think you've really made something that can be really top down and but has also kind of grabbed the grassroots approach as well. So anyone can use this. And I think thank you for everyone really explaining in detail all the ins and outs of gender response and gender equity. I think not only in One Health, but in general, in any kind of health challenge, this is something that is really important. So thank you, everyone, for bringing your expertise here. Ginger, do you want to add anything?
Yeah, absolutely. And same note, I want to thank you all. And I'm curious if I think Evan, you know, explain in the next steps, you know, that you are looking to pilot this, you know, and see how it plays out and get that feedback, you know, and continue to improve and grow all of your amazing efforts so far. How can, you know, people that are listening, folks out there that are interested in incorporating this, how can they support you all or, you know, or reach out to develop this further?
Well, people can find us on our website, and Evan will tell you about that because it's all his creation. And yeah, you can find us also all over the LinkedIn and Facebook and so on. But I forgot to say that we're not only European gang, we are all over the world gang. So if you want to join NEO as NEO or our gender group, doesn't matter, from all over the world, you're very welcome. Okay, and Evan, please tell them about our website.
Yeah, thanks, Sarah. Just to fill in a little bit with that, so all of the resources that we've talked about today, from the open access textbook to the journal articles with the One Health competencies, and hopefully this paper, this project that we're talking about now soon, is available on our website. So I believe that will be linked in the description. It's neo.network. So again, you can find that in the description. And then there's also a form on the website for you to join NEO. Currently, there's no fee for about the next 3 months. And so definitely do join. And if you're interested in gender, of course, we welcome that very much if you're interested in being part of the group. But also, as Sarah said, just to reiterate, NEO is a global organization, and we have members from different parts of Africa, South America, myself, obviously, North America at Tufts, all over the world, Asia. Some of our early career representatives are absolutely fantastic as well. So if you're sort of new to One Health and interested in getting involved on an early career perspective, you can reach out to myself. I'm all over LinkedIn and everything. So we also have a NEO LinkedIn page that you can follow. We'll be giving monthly seminars about the different textbook chapters, so you can learn more about that. But please do join if you're interested. We would love to have you.
That's fantastic. That's fantastic. And certainly we'll definitely link out to the neo.network page. We'll note that, you know, you can join. And I think you said there's no fee for now to join. And we're excited to see, you know, where this goes and how this becomes applied. And I really just want to call out to again, I really appreciate how you all have considered how to really put this to use and put this to action. I know for me, having been in this One Health space for a while, you know, part of my goal and our goal here on One Health Wednesdays has certainly been to like operationalize this, you know, let's do it. Let's put it, you know, into action in the field. And so incredibly exciting to see people like yourselves putting this to action and looking forward to supporting you in that. So we want to thank you all for joining us today, especially such a big group, getting folks, you know, from the worldwide gang together. Thank you all for joining. Thank you all listening for listening to One Health Wednesdays. And then, if this resonated and you're leading from the middle of complex systems and advancing One Health in your communities, we would love to hear from you. And as I said again, we'll include the link to the textbook and chapter in our show notes when that's available. And then we'll see you on Wednesdays. And thank you. I'll pass off to you, Julia, as well to close us off.
Yeah, thank you very much. This has been a topic that is very much close to my heart. So, as Ginger knows, I always try to bring topics that I really enjoy to talk about and to listen about. So, I've learned a lot today. I'm sure our listeners have learned a lot today. And you guys are just inspirational. So, thank you so much. Yeah, and that's it. Hope to see you all on next Wednesday.